Turmeric, a vibrant golden spice with roots in South Asia and a medicinal history spanning thousands of years. Today, turmeric is much more than a kitchen staple. It's a subject of intense scientific research. But what do modern studies tell us about its health benefits? And where does the evidence fall short? In this narration, I'll take you through what we know and what we don't about turmeric, based on reputable research and clinical data. Turmeric comes from the Curcuma longa plant, and its most studied compound is curcumin, a naturally occurring polyphenol. It's curcumin that gives turmeric its bright yellow color and much of its biological activity. But despite centuries of traditional use, rigorous scientific inquiry is essential to separate hopeful promise from proven effects. Let's begin with inflammation, one of the primary areas where turmeric has generated scientific interest. Curcumin is known to have anti-inflammatory and antioxidant properties in laboratory settings, acting on multiple molecular targets involved in inflammation and oxidative stress. These actions explain why it's been studied in conditions like arthritis, metabolic disease, and even neurodegenerative disorders. A comprehensive review of clinical trials found that many human studies evaluating turmeric or curcumin reported beneficial outcomes, particularly where inflammation drives disease. In randomized, double-blind, placebo-controlled trials, considered the gold standard in clinical research, curcumin supplementation was associated with reduced inflammatory biomarkers and improvements in conditions such as osteoarthritis and metabolic syndrome. Take osteoarthritis as an example. Meta-analyses of clinical studies suggest that turmeric extracts and curcumin supplements can help reduce joint pain and improve physical function. Evidence from systematic reviews indicates moderate quality support for such benefits, though the overall strength of evidence varies due to differences in study design. Similar musculoskeletal benefits appear in other research. One systematic review and meta-analysis looked at commercial turmeric extracts and curcumin supplements, finding that they can act as useful adjuvants in managing musculoskeletal health, with a low incidence of adverse effects. However, the researchers also noted diversity in dosing and product formulations, highlighting the challenge of arriving at precise clinical recommendations. Beyond joints, researchers have explored turmeric's potential in metabolic health, cardiovascular risk factors, and glycemic control. Systematic reviews of trials in individuals with prediabetes or type 2 diabetes found that curcumin supplementation modestly improved certain metabolic parameters such as blood glucose and lipid profiles. While results are encouraging, evidence quality was often rated as low, and more well-controlled trials are needed to draw definitive conclusions. One of the most intriguing and recent avenues of research involves turmeric as an adjunctive therapy in infectious disease. An updated systematic review and meta-analysis of randomized controlled trials in COVID-19 patients reported that bioavailability-enhanced curcumin formulations, like nano-curcumin, significantly reduced all-cause mortality, the need for mechanical ventilation, and clinical deterioration when used alongside standard care. It's important to emphasize that these benefits were observed in specific clinical settings under research supervision, and not from turmeric as a standalone remedy. So turmeric's potential spans a wide range of health topics. But now we come to a crucial point: bioavailability. Curcumin is notoriously poorly absorbed when taken orally. This limitation stems from poor water solubility, rapid metabolism, and rapid elimination from the body, which together reduce the amount of curcumin that actually reaches systemic circulation. researchers have shown that curcumin's oral bioavailability can be less than 1% in its natural form. To counter this, scientists have explored formulations that improve absorption. Adding piperine, a compound found in black pepper, can enhance curcumin uptake by slowing its metabolism, in some reports increasing absorption several-fold. Advances such as liposomal curcumin, nanoparticles, and phospholipid complexes further improve delivery. But these formulations also come with safety questions, especially at high doses. Let's talk about safety and risks. Most studies conclude that turmeric and curcumin supplements are generally safe when used appropriately. Health authorities like the U.S. Food and Drug Administration classify turmeric and curcumin as generally recognized as safe, and clinical trials often use doses up to several grams per day without severe side effects in the short term. However, safety is not guaranteed just because something is natural. Oral turmeric or curcumin can cause gastrointestinal issues, including nausea, indigestion, diarrhea, and constipation, especially at high doses. Some formulations designed to enhance bioavailability may present additional risks, including rare reports of liver injury. In fact, health monitoring systems have documented cases of hepatitis and cholestasis linked to specific high-dose supplement use. There are also limitations and gaps in the science that deserve honest attention. The National Center for Complementary and Integrative Health, part of the U.S. National Institutes of Health, summarizes that despite many studies, we don't know enough to definitively conclude if turmeric or curcumin is beneficial for any health purposes. They emphasize that product variability, inconsistent dosing, and a lack of large-scale, high-quality trials make definitive claims premature. In basic science research, curcumin has displayed broad biological activity, from anti-tumor and neuroprotective effects to immune regulation, but translating promising laboratory findings to consistent clinical benefits in humans remains challenging. Some reviews caution that curcumin's clinical translation has been limited by poor solubility, unstable metabolism, and inconsistent clinical outcomes. So, what's the balanced take? Turmeric, and specifically curcumin, has a robust foundation of preclinical evidence and encouraging human trial data in certain health areas. Clinical studies suggest potential benefits for inflammation, joint health, metabolic markers, and even specific conditions like COVID-19 when used adjunctively, but the evidence is not universally strong, and results often depend on formulation, dose, and study quality. For individuals considering turmeric supplements, experts recommend a few practical guidelines: pair curcumin with piperine or healthy fats to enhance absorption, choose products with transparent labeling and third-party certification, and consult a healthcare provider, especially if you have liver conditions, are on medication, or are pregnant. In closing, turmeric is not a magic bullet. It is a promising botanical with a rich history and an expanding scientific footprint. Its benefits are best seen as complementary to conventional care, not a replacement. The path from spice rack to therapeutic tool continues to evolve, driven by rigorous inquiry and cautious optimism. And as research advances, we move closer to understanding how this golden spice can fit into modern health with both enthusiasm and evidence. Here is the reference list for turmeric, Curcuma longa, health benefits and limitations, citing major health authorities and reputable institutions. The information presented in this video is for educational and informational purposes only, and is not intended as medical advice, diagnosis, or treatment. always seek the advice of a qualified healthcare professional or your physician with any questions you may have regarding a medical condition, medication, or dietary supplement. The views and opinions expressed are based on publicly available research and are not a substitute for professional medical guidance. Never disregard or delay seeking medical advice because of something you have heard or seen in this video. Dietary supplements, including turmeric and curcumin, may interact with medications or underlying health conditions and may not be appropriate for everyone. Individual results may vary. If you are pregnant, nursing, have a medical condition, or are taking prescription medications, consult your healthcare provider before making changes to your diet or supplement routine. The content creator and this channel assume no responsibility or liability for any adverse effects, outcomes, or damages resulting from the use or misuse of the information presented. If you found the information in the video useful, please subscribe, like, and comment below in support of our channel so that we can bring you more information to better your health. Thank you.